Okay, let's get started. Welcome, everyone. I'm Dan Tishner. I'm the director of the Wayne Morse Center's Program for Democratic Governance and Knight Professor of Political Science here. And thank you for foregoing tonight's women's basketball game to join us. I'm delighted that you can be here for tonight's panel, which is a discussion of Immigrant Oregon, featuring authors of an important new report. Actually, Bob, if you could hold it up, you can wave. It's titled A State of Immigrants, a new look at the immigrant experience in Oregon. This is an event that reflects the Morse Center's commitment to education and civic engagement as the building blocks of justice and democracy. Before we begin the panel, I would like to thank members of the Wayne Morse Circle. Circle members provide critical support for our programs through annual donations, small, medium, and large. Please consider becoming a Wayne Morse Circle member with a donation of any amount. And we're also incredibly grateful to our co-sponsor, the University of Oregon's Extraordinary Labor Education and Research Center. The moderator for tonight's panel is Robert Bussell, who spearheaded and edited this report on the immigrant experience in Oregon. It's actually the second report that he's edited for our state. Bob has been director of our Labor Education and Research Center since 2002, and he's also an outstanding labor historian whose most recent book is titled Fighting for Total Person Unionism, Harold Gibbons, Ernest Callaway, and Working Class Citizenship with University of Illinois Press in 2015. So Bob will be our fearless moderator for tonight's panel. So please welcome Bob.
Boy, I think this is actually the first public event I've spoken at in, well, a long time, it shows, right? Anyway, thank you very much, Dan, and thank you to the Wayne Morse Center for hosting this event. And I also just want to say this really beautiful report. I want to acknowledge Lee Roberts, who's sitting over there. Lee is our graphics designer at LERC, and there's a lot of sweat equity and time that went into this, and thank you, Lee, for producing such an attractive report. So I wanted to offer a little bit of brief background about the report, its purpose and focus, before bringing up our contributors who will be presenting this evening. So as Dan mentioned, this report builds on a previous report, Understanding the Immigrant Experience in Oregon, which appeared in 2008 and became a useful reference point for policymakers, practitioners, and the public. As you know, a lot has changed since 2008, both at the national and the state level, and our contributors agreed that it was important and timely to try to make some sense of these changes that have occurred over the last 13 years. As the most recent census confirms, Oregon is a state of immigrants, with foreign-born persons comprising nearly 10% of our state's population. Immigrants and refugees live in communities throughout our state, and they make vital contributions not only to our economic well-being, but also our social, civic, political, and cultural well-being. And frankly, another impetus for this report was the shared feeling among our contributors that in the wake of the Trump administration's, well, let's just say the most virulently anti-immigrant administration in the past century, voices and perspectives of immigrants and refugees were either obscured or drowned out, and the important work at the state and local level to support immigrants and refugees was also obscured. So to produce this report, we assembled a stellar team of publicly oriented scholars, not only from the University of Oregon, but from Oregon State University and Portland State University. And we also are grateful for support from the Mellon Foundation's Just Futures initiative that is enabling us to do some of these presentations and to disseminate the report. And copies of the report can be found in the lobby, the hard copy, and also at our website, lurk.uoregon.edu. You can also access it digitally. Our contributors identified the challenges immigrants and refugees face in adapting to their new environment and highlight the efforts by immigrants and community-based institutions to help newcomers become acclimated and achieve a greater sense of acceptance and belonging. The key concept underlying our research is that of immigrant integration. As one of our contributors, Lisa Shrestha, has described it, immigrant integration is a dynamic two-way process whereby immigrants and refugees develop a sense of belongingness that enables them to build relationships, craft identities, and explore new opportunities. The report covers critical areas in the integration process, such as education, healthcare, civic engagement, politics, work and employment, and arts and culture. And we're pleased to have 4 contributors here this evening to discuss their research. But before introducing them, I just want to add a final observation about the spirit of this report. It offers analysis of a state grappling with the legacy of its often exclusionary past, and it highlights its attempts to embrace the possibilities of a more inclusionary future. So I want to introduce our panelists in the order in which they're going to present. They're each going to talk for about 10, 11, well, maybe 12 minutes in some cases. And then we will leave plenty of room for questions and answers afterwards, and Dan will explain a little bit more about that process. Our first panelist will be Maggie Mattis, a doctoral student in critical and sociocultural studies and education at the University of Oregon College of Education. And Maggie is going to be speaking on a case study about the perspectives of transnational students at an urban Oregon high school. Next up is Danielle Lopez Ceballos, who is an assistant vice provost and associate professor of ethnic studies at Oregon State University. And see, there's no enmity between beavers and ducks, right? We are truly welcoming that you are here, Danielle. And Danielle will be discussing immigrant health issues. Batting third will be Lola Lustenau. Lola is a PhD candidate in the UO Department of Sociology and has also been a graduate employee at the Labor Education and Research Center, and she will be discussing immigrants' experiences as essential workers during COVID-19. And batting cleanup will be Lynn Stephen. Lynn holds a Philip H. Knight Chair as a Distinguished Professor of Arts and Sciences and a Professor of Anthropology, and she's affiliated with many other departments at the U of O as well. And Lynn will be discussing Guatemalans in Oregon and their experience with seeking asylum and surviving COVID-19. So with that, I'm going to invite our panelists to come up, beginning, and Maggie will be the first presenter. And thank you all for coming. Looking forward to a lively evening.
All right, thank you very much, Bob. And I really want to begin tonight by acknowledging that this work that I'm going to talk about is a collaborative effort. I'm really very fortunate to work with a research team that is absolutely fantastic. Our research team is comprised of Dr. Audrey Lucero, who is a faculty member in the CSSE program, as well as my colleague Bobby Bermudez, who is a fifth-year PhD candidate and was really kind enough to be here tonight as well. So our research focuses on the perspectives of transnational students. And we're going to talk about a case study that we made out of one specific Oregon urban high school. But before we can get into that, what really we need to talk about to start with is some demographic numbers, and also we need to define exactly what we mean by this word transnational. So starting at a global perspective, it's becoming more and more common for an individual to be born in one place and then spend a significant or maybe even a small portion of their life in another. We see this in the United States as the international communities continue to grow. And we see this here in Oregon specifically. So according to the American Immigration Council, as of 2020, 1 in 10 individuals in Oregon identifies as an immigrant. But going hand in hand with that, in our state, out of 9 individuals that were born in the United States, 1 out of 9 identifies as having a parent of an immigrant background. So these numbers make it increasingly likely that students with multicultural or transnational backgrounds are attending Oregon schools. And for many of those students with transnational backgrounds, schools are the point of engagement, possibly the first point of engagement with another culture. So let's turn our attention to this idea of transnationalism. What exactly does that mean, and how are we utilizing it in the work that we're talking about? So transnationalism is a sociological term, and it really comes as a response to this continuing changing global demographic. It focuses on crossing borders in that globalization context. For the purposes of our work, we're aligning with the Jaffe, Walter, and Lee definition, which refers not only to a physical journey and that physical act of crossing international boundaries, but also a metaphorical movement back and forth between someone's home culture and a potential new culture. And that culture could take place in a variety of aspects of daily life, and that includes school, work, or community engagement. And so as we use this term, we're talking about individuals who grew up with a mix of international cultures and traditions and languages, and did so and engaged with those identities regardless of their immigration status. So thinking of those two conceptions, I want to move to our pilot study. Our pilot study, the initial idea was to better understand the transnational experience and how these identities take form. We wanted to look at cultural and linguistic practices of students who self-identify as transnational, and we also really wanted to understand how these students in their schools, with their teachers, with their administration, with their fellow students, build a sense of social belongingness. And social belongingness is really defined as the basic emotional and psychological need for perceiving acceptance. And that can come from meaningful relationships with classmates, teachers, or really anyone else within the school system in this particular setting. Now, like many folks within the university system, we had a specific idea for this pilot study, and then COVID happened. Yes, it's a well-known story. So instead of doing one-on-one interviews and possibly focus groups, we had to make a pivot. We'll all learn the dance called the COVID pivot. And so what we ended up doing was creating an online survey that used two specific applications. We used Nearpod and we used Flipgrid. And those applications were chosen for this survey specifically because they allow a variety of modalities in which students can create their responses. So you could write, you could video record yourself, or you could just make an audio recording of your answers. And so in doing that, we hoped we could get more authentic answers from students in a time that felt very distant. So our pilot study happened in January of 2019. And we wanted to focus on students' perspectives within this pilot study. And there were multiple reasons for that. Much of the research on transnational students really does focus on academic achievements. And instead, we wanted to add to the body of work that considers adaptation of those students or their experiences as told from their perspectives. We also wanted to try and enable others who work with these students to better understand the challenges they face, and also we wanted to challenge assumptions made about these students. So our pilot study happened, we sent out our link, and it got picked up by one specific urban high school outside of Portland. And so looking at our pilot study data, we got a really interesting set of students. We got 33 total to respond, and of those 33 students, 29 of them were born in the United States. 4 of them were born outside the United States. And from our charts, you can also see the majority of our students were born in Oregon. But despite these transnational students being mostly from this area, they have a very interesting, kind of very wide cultural background. So looking at this, we can see all of the home languages spoken by these students. We can also see in terms of where they identify, and this is totally self-identification. How the students see themselves. Our biggest group was actually a mixed heritage group. And so the big caveat with this is it's not representative of Oregon transnational students as a whole. According to Oregon Department of Education, data shows that Latinx students make up the largest share of minority students, and that's not the case particularly in our study. And so what we ended up doing is really looking at the school as a roadmap of what can happen with transnational schools or transnational students in schools, and also how can we make recommendations to other schools as to how they can support these identities. Okay, so pilot study findings. Overall, these students were overwhelmingly positive in their responses about their school, their relationships with their teachers and the administrators. The student, who's 14 years old, from the Philippines, stated, "Teachers and administration support transnational students through helping them feel more comfortable in the school environment, through translating or speaking to them in their native language, and by introducing them to veteran students who help them around the school." This really shows that teachers are working at those relationships, and students very much find that appreciative. And also, it really displays a multi-layer approach to building that belongingness that we talked about earlier. Also, students have a very strong relationship with their heritage language, especially when it's encouraged to be spoken and really seen as an asset to the classroom rather than a deficit. So another student stated, the student was 18 years old and from Vietnam, "We often have conversations about different cultures and perspectives, especially during Culture Week, where people from our community are invited to speak about their culture and what they have experienced." So again, we continue to see culture as an aspect to showcase and even celebrate that aids in that asset mentality. Also, looking at figure 9 here, we asked the students very specifically whether or not they had felt singled out at school. These students responded overwhelmingly no, but the students, this part was interesting, that pointed out that they had actually pointed to incidents that had occurred at previous schools, specifically in middle school. So looking forward to what we can recommend and what we can continue to build off of with this case study is teachers acting as facilitators and partners in the building and sharing of transnational identities within schools. Again, thinking of transnational identities in the classroom as an asset, not a deficit. And teachers making an effort to understand students' perspectives, whether that is their home culture, their language, or potentially where the students are from. And finally, this was our pilot study. We did kind of a very preliminary analysis of the data. We've spent, since this report was submitted, the better part of the summer, and we will spend the remainder of this quarter discursively coding this data. So we're moving on to try and look more specifically at what we can discover about these students' experiences in this school. So right now we are focusing on answering these specific questions as to how these students position themselves within their high school. And that is all that I have today. Thank you all so much for your attention.
All right, let's try to do this. Thinking about it. Good evening. Thank you for being here. As Bob mentioned, I'm Daniel Lopez Ceballos. I'm with Oregon State University. No hard feelings. But I have to say that through this process, COVID right in the middle of this project, I've always appreciated Bob and the team, fellow colleagues working on this report and the commitment to see it through. 12 years have passed since the previous report, and so 13 years now, and so very important to see and to have this space to bring new light into the issues that immigrant communities across Oregon are facing. So my chapter touched specifically on health issues, healthcare, but as you'll see over time, and also I think it's a reflection of my own growth, it's more looking at more from community to policy, institutional level issues. I'll explain here more in a minute. Just to provide a few more data points on the immigrant or foreign-born population in Oregon, has grown consistently over the past 3+ decades in Oregon. You can see the first graph there, from about 5% in 1990 to close to 10% according to the most recent data. The second graph is something I always try to use with my students. I've taught a migrant health class for the better part of for a decade, about a decade now. And I always show these, this is from a tool called the Census Reporter. And as you can see here, so we look at that population, but if we look at the place of birth of that foreign-born population, yes, about 43% is from Latin America, but you still have about 34% of the foreign-born population in Oregon from Asia, about 14% from Europe, and you can see that from other places in Africa and North America. So, and depending on the community, I've done versions of these presentations in different parts of the state, and so I try to bring it down to those local communities, and that makes changes. And what I tell folks is it's an important piece of sort of what we need to, how we need to understand those communities and the different needs of those communities that aren't the same, right? We can just paint with a broad brush on those communities. Certainly, as Bob mentioned in introduction, we face a renewed anti-immigrant climate, perpetuating myths of immigrants as quote-unquote underserving of receiving health or other social benefits. And certainly what we've seen most recently is that from those perceptions, for the longest time what we've studied is about those perceptions or even just the discussion, the debates, but what we've seen most recently that those have moved from words to actual policy changes. A recent example is the public charge. Yes, it has been stopped. I mentioned this as of March of this year. There is public charge that enforcement or the application of that measure is discontinued. But as you can imagine, even the debate about these issues, about the potential change for the way in which an immigrant wanting to apply for legal permanent residence or citizenship, will this be held against their application? And so what happened here in 2019 is that actually did happen. And so that has had, and other colleagues have pointed these out and studied these as well, has had real chilling effect implications. Because again, they move, or it didn't just stay in words or a debate in the public square, but we actually saw policy changes following the suit on that front. Certainly what we've seen in the past 20 or so months with the pandemic is that, one, it has made it perhaps even more evident and exacerbated the perceptions around that the communities most directly impacted by the pandemic. So you've heard this a lot, frontline, essential workers, but those sectors rely heavily on immigrant, low-income, and people of color labor. I don't have data specifically looking at immigrants. One of or immigrant populations, one of the things I wanted to do for my chapter, so acknowledging, and this is mentioned in the book as well, yes, when we think about the immigrant population in Oregon, a majority of that population is Latinx, or coming from Latin America, but not only. There are other communities as well. So I've tried as much as possible to provide or to point out the immigrant population, but certainly there are connections, there are overlaps between those communities, but they are not exactly the same. But as you can see here, at least data from African American and Latino workers, and all that list of different quote-unquote essential sectors of our economy are all represented among those populations. Certainly, then we see the consequences on cases, on hospitalizations, on deaths related to COVID. Interestingly or sadly, I would say, we don't have an accounting of knowing specifically about the immigrant or foreign-born population. We have, over time, improved a little bit our accounting by race and ethnicity, by gender, by age, on the impacts of COVID-19 among these groups, but not so much on other characteristics, including immigrant populations. When we think about unemployment, I wanted to point out here that across numerous sectors of the economy, certainly true both in the US and Oregon more specifically, depend on immigrant labor, and a portion of that immigrant labor, certainly undocumented labor. But you can see in the graph there that the unemployment rate is significantly lower among the foreign-born population, both nationally, and is also true in Oregon. So unemployment rate very low for the foreign-born population compared to the US-born. However, when it comes to income, those jobs, as we mentioned, that overrepresentation among in essential but low-wage jobs then translates into low wages that rarely offer health benefits and expose these workers and their families. We see these with the case of pesticides, for example, exposed to higher occupational risk and health risks ensue. In 2016, the most recent data I could find, agricultural workers, the annual wages range from about $17,500 to $20,000, well below the federal poverty level for a family of four at the time. So as I mentioned, the unemployment rate is really low, or the employment is really high. Employment rates are really high, but the income doesn't match with that high employment rates, and you can see that foreign-born, both in Oregon and the U.S., are lower than their U.S.-born counterparts. Immigrant children are more likely to live in households that U.S.-born children. Let me back a little bit on that. So U.S.-born children, the data, the most recent data I could find show that U.S.-born children are more likely to live in homeowner households, meaning they're more likely to own or have a mortgage on their. The data doesn't quite separate the two. That's a topic of another conversation. But compared to foreign-born children, so that certainly has consequences when thinking about the quality of that housing. We're thinking about the pandemic. Certainly, one of the things that has impacted or extended increased the rates of COVID-19 has been the housing conditions of families, immigrant and otherwise. Interestingly, about 60% of U.S.-born children in Oregon had a foreign-born parent living in the U.S. for 15 years or more. And so this certainly has been the case in the work that I've done over the past 15 years in Oregon, that that first generation, the immigrant parents, have been living in the U.S. for a long time. And so that has also consequences for how we interact, how we work with those populations. I mentioned later, for example, the CARES Act drew a clear line between who benefits, who would receive that benefit or not, by who had Social Security or not. And at least in that first wave of relief, excluded not just the person that didn't have a Social Security number, but the entirety of the household, U.S. born or not. And so that also has implications for the health and well-being of those families, those communities. So what I propose in the chapters I discuss of a health equity approach to a health equity lens to this work, couple of things here. One that looks at the multiple levels of influence on an individual or community health. So when we think about immigrant populations, then all these different layers have implications for the health and well-being of immigrants in Oregon. And what I showed you in the graph there is a tool that we've used. This is in Spanish with Spanish-speaking families in our local Bennett County that highlights sort of the different levels, thinking about food and access to food and all the different at every level, from the individual to family to organizations to community to policy. What are the influences on the health, in this case, access to food? And the other aspect of these two that I want to bring to the table here is a reminder of the difference between providing equally to different communities versus bringing an equity lens, meaning that there are communities that require more resources, more supports to provide for an equal opportunity to the same levels of health and well-being. And so that when we apply into what we think about and supporting these communities, that certainly comes into play. Health insurance is an example of sort of the disproportionate effect of how policies as enacted. The ACA, yes, it did expand Medicaid, but it had an exclusion for undocumented individuals. And so you can see that the lingering insurance rates for Hispanic Latinx communities in particular. Thank you, Bob. 1 minute. This is a piece of information I wanted to bring back, about a minute, thank you, for something that we did back in 2014, pointing out this sort of providing data to undermine these myth of the burden to safety net services. What you see in the zeros at the bottom is that really when we think about uncompensated care, so care that hospitals don't get paid for, and hospital expenditures in particular, the last line is very, very small. You can see that the most recent data was 0.01% of all their expenditures related to care that they gave to individuals, but they didn't have a way to get their monies back, was tied to undocumented immigrants. So very, very small percentage of that. One thing that builds on that multi-level framework I showed is that there are other explanations other than individual or culture-driven models that miss out on issues such as residents in low-resource communities, institutional patterns of unequal treatment, and so forth. And so that also needs to come into play. I have to say, though, that over this past decade, I've seen a number of efforts across the state, community-based, community-engaged, the efforts around building associations like the Community Health Workers Association, the Healthcare Interpreter Association are taking us farther in that, and very much we're robust immigrant community representation. I have to add to that too some policy successes. You know, we've had challenges, but also some successes. I want to take, I think there's more I mentioned in the chapter, but I think there's much more that needs to be written, that should be written, that I hope some of you in the audience take that message, and because I think there are lessons there as to how to go about in coalition building, in getting legislation passed and enacted. In one of the cases, prenatal care for all women was an administrative solution. It didn't go through the legislature, but it happened. But it happened in part because many counties, although they would receive more money, they didn't want to receive that money. They would receive more money than they would put on the table, and yet they wouldn't do it. There's a number of pending issues, certainly along mixed status families and policy efforts that take that into account. I think it's important that more needs to be said about that when we're trying to draw lines as to who benefits and who cannot benefit from policy, from programmatic changes. I'm hopeful that the last thing I would say is the SB 70 that passed expands on the regional health equity coalitions across the state, so an important space too to bring communities, immigrant communities, to the table to guide health equity efforts across the state. And I'll stop there. Thank you.
Hi, everyone. I'm Lola Lustano. I'm a PhD candidate in the sociology department. Can you hear me from here? Yes. Okay. And I'm really happy to be here. I wanted to thank Bob for inviting me to be part of this report and this presentation, and all my colleagues who did amazing work in this report, and all of you for being here. So what I want to do today, in the brief time I have, is give you like a quick overview of the experiences of low-wage migrant workers in Oregon, particularly highlighting their contributions as essential workers, right? And this, an identity that was clearly magnified by the pandemic, but that existed beforehand, right? And using data that Bob and I collected through interviews, mostly with Latinx workers across the state and in different sectors. And at the end, I want to take a little bit of time to discuss what's happening right now regarding some of the COVID-19 and heat and fire hazards regulations in the workplace, since they're like really pertinent to understand the job quality of migrant workers here in Oregon. So to start, I wanted to share some general statistics about migrant workers in Oregon that kind of complement a little bit what Daniel just shared. So migrant workers in Oregon make up 13.2% of the civilian workforce and 14.6% of essential workers, right, employed in sectors such as healthcare, childcare, janitorial services, construction, agricultural work, and food processing. Migrant workers make important contributions to Oregon's economy in terms of taxes and consumer spending. In 2018, for example, migrant-led households paid $2.8 billion in federal taxes and nearly $1.3 billion in state taxes, and state and local taxes, and generated $11 billion in after-tax income consumer spending. Despite these amazing contributions, what we also find is the continued existence of segregated labor markets, which means that many migrant workers are actually incorporated into Oregon's economy as cheap and disposable labor in industries that have pretty degraded working conditions. So migrant workers are often found, as you can see, in industries and workplaces where violations of safety and health regulations are very prevalent. For example, in 2018, Oregon agricultural industry had the highest fatality rate of workplace fatalities, right? Followed by transportation and construction. As we know, agriculture and construction are two sectors where migrant workers are overrepresented. Corina Spencer-Sirich, who is the director at the Northwest Workers Justice Project, an amazing legal rights organization, explained to us, right, how wage theft, misclassification, and discrimination are really prevalent in workplaces with large migrant workforces, right, with employers often failing to pay accrue overtime, workers not getting proper breaks, and temp or staffing agencies making extra deductions from workers' paychecks. So going a little bit more detail into the working conditions, right? What we find is that the workers that we interviewed share experiencing really lengthy work days and work weeks, right? Many of them on shifts of over 10 hours and with work weeks of 6 and 7 days. Unpredictable schedules were very common, right? And that contributes to the fluctuation of workers' income and their precarity. Some interviews share that they struggle to find jobs that match their skills and interests. So work in the fields, of course, is usually most readily available, but is poorly paid, is physically demanding, and it has little to no growth opportunities. Interviews also discuss how lack of English proficiency has continued to be a limit for labor mobility and for their capacity to self-advocate in the workplace to improve their conditions. Workers with dependents, particularly women with little children, discuss the difficulty of accessing affordable childcare that provides services during the non-standard hours that many migrant workers have. Importantly, workers share the continuous experience of sexual harassment and racism in the workplace. I'm sharing the story of Arturo, who worked as a caregiver for many years, and explained to us a common situation that he experienced as he worked at an elderly care facility, right? And he shares, you're dealing with people who are not used to interacting with people who are not like them. And they see you, your brown skin, and the family members would say, I don't want that man treating my mom. And what can we do, right? The problem with this has structural consequences, right? And what happened is that Arturo and other of his Latinx co-workers were most often assigned then to patients with more severe health or behavioral issues, right? Thus increasing the likelihood of being exposed to like more physically dangerous situations. So given these working conditions, we can see how migrants employed in critical infrastructure industries experience being acknowledged as essential workers since the pandemic started, right, as an ironic achievement. Workers shared worries about coming into work when the pandemic started, but they knew they had to do it anyway because of their essential status, right? For example, David, a sanitation worker, shared his and his wife's experience, saying, I was worried about COVID-19, we think it's dangerous, and we understand we're old and it's risky for us, but we're essential workers, and we need to keep going, so we try to be safe. And they had reason, of course, to feel like that, because as Danielle was mentioning, right, migrant workers were disproportionately impacted by the pandemic. Just to give you an example, in Oregon, the second highest number of workplace outbreaks of COVID-19 after public administration, which includes prisons, right, and detention facilities, emerged in food and beverage manufacturing, where over 30% of the industry are migrant workers. Agriculture was also highly impacted, experienced the 8th highest number of COVID-19 cases in the state of Oregon between June 2020 and March 2021. And what we also found is that employers were not really properly protecting these essential workers. A cannery worker employed in the Oregon coast reported that in late May 2020, right, so the pandemic was quite advanced, we all know what was happening by then, right? Her employer was still not providing masks or enforcing any social distancing measures in the workplace. And unfortunately, this is not a single story, and this is what we found in a lot of workplaces, particularly in food processing. In another instance, an agricultural worker divulged that she and several of her family members were denied access to water and sanitizer while working in the fields. And you have the quote right there, right? This, Maria shared that after repeatedly asking the mayordomo for water, he brought one bottle, right, for everyone, no cups, nothing. They were expecting all of us, Maria said, to share, and I was very thirsty because it was really hot. This was last summer, not the 2020 summer. But of course, she said, I was not going to drink from there. And she didn't know, and she shared that she didn't want to drink from there, not only because she was afraid of getting sick, but she was afraid of bringing the virus to her home and to her children, right? In another case, a sanitation worker employed in a hospital through a temp agency explained that when the pandemic started, she was not provided with any masks, as they were reserved for nurses and doctors, even as she had to work in close contact with biohazards, which triggered much anxiety for her. And the worker, of course, ended up quitting her job because she was too afraid of getting sick. For workers with H-2A visas, the situation was even more dire. Workers employed in fish canneries at the Oregon coast reported being housed in hotel rooms that lacked proper facilities for cooking or laundry. But since they were not technically agricultural workers, they are manufacturing workers, OSHA's COVID-19 rules for agricultural labor housing did not apply to them. Workers in precarious migratory statuses could not access unemployment benefits, as Danielle was mentioning, if they were unable to work or had fallen ill. They were often not able to return to their jobs after missing work for a few weeks due to showing COVID-19 symptoms, right? And that meant, for example, that according to some of our interviews, in some cases, temporary workers' contracts were terminated, and they were sent back to their home countries, even if they were still fighting the disease. So of course, we can argue that this discourse on essentiality, mostly serve actually to justify an uneven distribution of risk, right? One that disproportionately impacted migrant and BIPOC workers and their families. But it also exposed the system's dependence on the labor of the very workers that treats us disposable. Undoubtedly, this discourse to keep, was used to keep many migrants working under dangerous conditions. But by acknowledging their essentiality, both employers and the government also created a framework that produced a moment of public recognition, right? And in this context, and despite the many barriers that exist, we witness migrant workers fighting to improve their working conditions and increase workplace safety, whether it be via making complaints with state agencies, starting lawsuits, or organizing collectively. So elaborating, on the impetus of many of these actions that we witnessed and we read through in the papers, right? Organizers and advocates we interviewed explained that the pandemic brought together many organizations that have been working separately, producing a synergy that has translated into new coalitions working to improve migrants' working and living conditions. So, despite we have a long way to go, especially in what relates to state agencies' efforts to regulate working conditions. So while Oregon was one of the only states that made its temporary COVID-19 rules, workplace rules, permanent, some of its provisions are right now being repealed, even as the pandemic continues. The pandemic raised many questions about employer-provided housing, which primarily impacts migrant workers since it's in agriculture, right? So Oregon OSHA, which has been actually since November 2018, doing a comprehensive review of agricultural labor housing rules, should actually consider making some of the COVID-19 rules permanent. Some of the COVID-19 rules, for example, include ensuring, sufficient space and mandating employers to provide cleaning and sanitizing products. And this should not be something that is just temporary or related to the pandemic. This should be something that is permanent regarding to housing for agricultural workers. This also brings us to the rules regarding excessive heat and wildfire protection, right, for workers. Well, OSHA had been directed to start a proposal for worker safety in extreme heat and wildfires in February 2021. This was delayed due to the pandemic. And it wasn't until the death of Guatemalan farm worker Sebastián Francisco Pérez, right, during the heat wave in June, that temporary regulations were enacted. These temporary rules are a start, but they're insufficient. These rules, for example, still indicate that employers only need to provide shade if it's feasible, right? Again, putting on the employer's discretionality, the possibility of not protecting workers who are already vulnerable, as we see. In the upcoming month, actually, Oregon OSHA will have public discussions regarding many of these rules. And the U.S. Department of Labor announced just yesterday that it's initiating a rulemaking process to protect workers from heat hazards, and will be taking comments for the next 2 months. So this is a key moment, actually, for definitions regarding job quality for many migrant workers, and important changes need to happen. And finally, even after migrant agricultural workers continue to risk their lives during the pandemic, through the fires and the heat waves, Oregon lawmakers failed to pass legislation to require mandatory overtime pay for farm workers in the 2021 legislative session, despite being a bill there that proposed that, and actually Washington did pass it, Washington State. And they continue to be the only low-paid workers in Oregon that don't get extra hourly compensation when they're required to work extra long hours. So to end, the COVID-19 pandemic clearly exposed the system's dependence on the labor of racialized migrant populations, and also its continual treatment as they are disposable. In order to improve working conditions for migrant workers, Key agencies such as BOLI and Oregon OSHA must be given necessary resources to expand their capability to ensure the reduction of workplace, wage, and safety violations that severely impact migrant workers. And at the same time, the present situation calls for the exploration of systems of just enforcement, right? Strategies that would allow workers and allied organizations to sue employers for ignoring or violating labor laws. And we must support organizations such as Pioneros Campesinos Unidos del Noroeste and the No Workers' Justice Project as they organize to improve migrant workers' rights. So as the pandemic moves to more open stages, more flexible stages, things cannot return to normal for workers who have for so long endured some of the most dangerous working conditions while being denied access to political and social rights. So it is clear to me that improvements to migrant workers' job quality are directly connected to the much needed changes in the immigration system of the United States. Thank you.
There's always this little pause. My name is Lynn Stephen. I'm in the Department of Anthropology. I also am an appreciative guest settler here on Kalapuya Ilahi land. I want to thank Bob and my colleagues for all of this amazing work. And I also want to pick up where Lola left off to sort of dedicate this in memory of Sebastián Francisco Pérez, who is a Jew indigenous farm worker from Huehuetenango, Guatemala, who died in St. Paul in the summer, since my talk is about Guatemalans in Oregon seeking asylum, surviving COVID. So I'm going to speak from a collaborative research project called the Oregon COVID-19 Farm Worker Study. This is a project that we did with 12 community-based organizations in Oregon to broadly assess the impact of COVID-19 on farm workers and their families. And I really appreciate all of the stuff that Lola said, which really goes with a lot of the things that we found that I won't have time to talk about, all of it. It involved a survey of 300 farm workers spread out across the state. Then we just finished up doing in-depth interviews with about 45 of those farm workers. And about 25% of our survey sample and of the in-depth interviewees are indigenous farm workers from Mexico and Guatemala. So in my chapter, I drew from that larger data set that is very collaborative, involves about 8 different authors and many, many promotoras and people who went out to talk with folks or talk on the phone. And I also did some of those interviews for the survey, and then I also draw 9 interviews that I did, in-depth interviews with Guatemalan indigenous farm worker families. And in the chapter, I try to draw this connection between US foreign policy in Latin America, support of authoritarian regimes, and immigration, right, refugees. Why did people come? That's a picture of Rios Montt and Ronald Reagan meeting. Reagan was a supporter of Rios Montt. Rios Montt was actually convicted of genocide. Then that was overturned. But in Guatemala alone, 200,000 people died. 1 million people were displaced, also from Central America. So this connection that we have isn't just trans-border through the routes, but it's political. And it goes back a long time. So I just like to underline that. And so the history of Guatemaltecos and other Central Americans in Oregon is tied to that foreign policy and goes back to that. Another sort of important point in immigration history connected to how and why people from Guatemala sort of settled, became permanent, and we now have a multi-layered community that includes citizens, citizen children, people with residency, but more recent, a lot of people who are undocumented. Has to do with the 1986 Immigration Reform and Control Act and the Special Agricultural Workers Program, which was the last time anybody got a chance in any significant numbers to regularize their status. But it's an important part of the story. And one of the other pieces of the story I'm going to talk about is differences within the Hispanic population, Latinx, but while it has been majority Mexico, the numbers of Central Americans has been inching up in the state. And I'm also going to talk about diversity within the category of Latinx and diversity even within those national categories to particularly look at Indigenous folks. So the numbers of Guatemalans in Oregon, I've spent a lot of time digging for data, and it doesn't necessarily show up in the census very well. There's a lot of people who are undocumented, and there's really no information about anything beyond nationality. The census does have this category that allows you to register your tribe, but that doesn't really resonate for people from Latin America, from Mexico, from Guatemala. People identify as pueblos originarios, original First Peoples. They don't identify as tribus or tribes. But we can see that the share from Mexico is kind of dropping. And at this point, we don't even know. I was trying to find from the 2020 census, but probably 20,000 or more. And again, we don't even have good figures. So I use a concept in my work called transborder that I've been using, I think, since the early 2000s, that talks about how communities are built not just across national borders, but they are crossing, as you mentioned, cultural borders, they're crossing racial borders, and communities, and this is the same for Guatemala, it's kind of a history of building these communities through time that have different layers. So one small town in Huehuetenango, for example, Sebastian's town, or some of the towns I've been doing work in Guatemala, there's people in 5 locations in Oregon and 8 locations in California and Grand Rapids, Michigan, and New York, in different parts of Mexico and in Guatemala and in different parts of Guatemala. So they're sort of networked and building community here. This is just a picture of a dance of people from Todos Santos, Cuchumatan, in the northern part of Oregon. But people are networked and they're connected. This is a map from our project. It's probably super easy to read, but we identified 26 different indigenous languages just in our survey of 300 people in Oregon, from Guatemala and from Mexico. And there are probably more languages. So that gives you, I wish I could overlay, we need to be able to overlay a map of Oregon on this so we can see where these folks are in our state. And one of the other things I wanted to point out is that the building of these diasporic communities that I point to sort of starting in the 70s with US foreign policy continues. There is still, this is a record year for enforcement actions as defined by US Customs and Border Patrol. Almost 2 million. Now, because of Title 42 and some of the other limits that Trump put on people coming in that are still standing, a lot of people are making multiple trips, but it still is a record number of people. There's a record number of unaccompanied minors also, and there are probably just 30,000 alone from Guatemala just in the past year. The other way we can see this community building is through cases of asylum. Right now, there's nationally 1,457,000 plus cases, pending immigration cases. They're not all asylum, many of them are. In Oregon, we have 3,645. I serve as an expert witness often for asylum cases, and they're going years. People are waiting, the average wait is 926 days. And some of the folks who are farm workers are, they have pending asylum cases too. So I'm going to focus in on Guatemalan indigenous farm workers. There's different numbers, but Oregon probably has about 174,000 seasonal agricultural workers and family members. The number of workers today, Reina Lopez from Pecun spoke in my class. She puts it at about 80,000, actual workers. And then we don't know how many are undocumented, but there's many guesses from 40 to 70%. And there's a lot of recent Guatemalans, particularly indigenous Guatemalans, among them. And this study, one of the big things that came through for everyone was how much work time people lost. And this is someone I'm giving a pseudonym, Jose, who says, we lost 2 months of work. We didn't start work until halfway through May, beginning in March of 2020. His wife lost a lot of work. And then he began to talk about, well, on the other years when there's not a pandemic, we also lose work in November, December, January. If it's cold, we don't go to work. So again, all of these narratives sort of reveal all the already existing inequalities and issues. We found a lot of language barriers, lack of access to crucial information. We did a lot about workplace safety. Did people provide masks? Did they ride on a bus? What happened in their breaks? How closely did they work together? Access and knowledge about public services, support programs, quarantine, rent assistance, and language barriers. I'm not talking about Spanish. I'm talking about folks who don't speak Spanish, right? So, for example, a quote, well, I understand some Spanish, which is a language they use when they talk to us, but not everyone speaks Spanish. Where I work, and this is really big, like the whole berry harvest has a lot of indigenous workers. We speak Mom. I translate for my wife and maybe another friend, but not everyone. And he's talking about worker safety talks, like people are getting these worker safety talks in Spanish or English. I mean, in some places, 100, 200 people. And, they're not understanding, obviously. A point that a lot of people have made, but this also came through in our study, is that indigenous women, even more than indigenous men, reported losing months of wages for months because they were staying home to take care of their kids. No child care. A lot of people who ran family daycare stopped because they were afraid to have other people's kids or have their kids exposed. So women stayed home more than men to take care of their children. Overall, indigenous farm workers lost more, this is a quiz, I forgot to put a word in, more work time than non-indigenous workers. And a higher percentage of them are more recent arrivals and they're undocumented. So this was the underlying factor also of losing work time, was they were often the first, the last hired, the first let go. And this was something that was really interesting. Guatemalan indigenous farm workers, like all farm workers, many farm workers, are sending remittances home. They are supporting people in their home communities, their parents, their siblings. I interviewed one person whose wife and 2 daughters were deported, and he was here working, harvesting salal, harvesting berries, and trying to send money to support them in Guatemala while he was trying to pay his rent in Cottage Grove, and trying to be at home supporting the one, a son who was still with him, who was like going to school. They had no internet. The school gave them a tablet. He couldn't, he didn't read. So just all of these ways of care work. And people could not send money for a period because they weren't making money. So there was a big impact in their home communities as well. And people talked about calling several times, checking on their relatives, until really recently the vaccination rate in Guatemala was about 2%. And COVID was just ravaging a lot of places, and in Mexico too. So one of the most incredible things that I didn't put on this slide that I should have was the way that people, particularly recent mom immigrants or farm workers, began to support each other when they had no access to, rent relief or didn't even know about programs. They formed like these small mutual aid societies where they would pay hospital bills or support people. And I mean, that's happened for a long time in immigrant communities, but when the people who have the least are, sharing it with other folks. Okay, I got 1 minute. One of the other things that came out of the work that we did was the real desire for folks from what we're calling Mesoamerica, that refers to Mexico and Central America, not wanting to be lumped into categories of Hispano or Latino. They really, in a lot of interactions in a big conference that we had, with a lot of participation from people, indigenous people from Mexico and Guatemala, they really are engaged in this struggle to distinguish themselves from Latinx people and get recognition for their own organizations, their own communities, and their own ways of sort of talking about themselves. This is just a slide of 2 young men collaborating on a video actually for the Oregon Health Authority. It was one of the finally things that began to happen of talking about COVID in mom. So we also had a lot of policy recommendations. A big one, farm worker overtime, which actually Piccoon is working on, and there's going to be a big campaign in the Senate for that. This would make such a difference for all these folks who lost months and months of income, have debts, came here with debts. Legal and service navigators who speak Indigenous languages, COVID-19 vaccinations, testing, work safety information in Indigenous languages, and extending all of those protections from rent control, quarantine relief, the worker relief fund, because if they were connected to Piccoon or another organization, they might have had access to that. But most people are not connected to organizations. And finally, a project I'm working on probably with a colleague here, Gabriela Perez-Baez, who is in linguistics, is to actually do that map I was talking about where people are, what the languages are, along with some other information. We've just gotten a lot of calls from many people in the state, from like the Springfield Utility Board, school, so there's just, and there is a lot of connectivity, and I feel like there is hope, at least in terms of how many people are talking to one another. So thank you very much.
So thank you to all the panelists for great presentations. We have time for a few questions. So I just explain how I think logistically this is the best way to do this is I have a handheld mic. I'm not going to hand it over to you though. So if you have a question, I'll hold it for you, and we'll do it that way. Let me make sure this is on. So, questions from anyone? You're wowed to silence.
Pretend you're on Zoom.
And you guys can also, if you have questions for each other, let me know. I'm not going to give it up.
Oh, okay, sorry. Lynn, I had a question for you just about the policies that you were just bringing up. I was wondering if it was kind of sustainable to say you have translators for mom in the fields and places where migrants are working. Is that a sort of sustainable practice, I guess, when you're thinking about resources? If that makes any sense.
And Lynn, can you go up there to
Yeah.
this for our video? Thanks.
Thank you for the question. I think the idea is not to have translators in the field, but in fact to require that basic safety information You know, because under COVID and even in worker trainings, it's not like a one-on-one situation, but if there's 100 people getting a training, right, then you can have one person who speaks Hmong. You can empower one person to do that. There has been some progress made, I think, in terms of PSAs relating to vaccinations, to COVID, to some other things. They actually have gone out in, I think, 5 or 6 different Indigenous languages in Oregon. State of Washington, the Washington Health Authority has put out a lot more stuff in more languages. So I think, yeah, one person translating doesn't work, but having at least, when you look, you can look at, there are different ways to look at, you know, what languages are the most common. I could tell you, you know, which ones they might be, but they're also very specific because, for example, there's a lot of different variants of Hmong. So knowing like super local information is also important. I think it's more about starting a model where you acknowledge that people are there, you put some information out, and I think social media is a really good way to do that because most of these folks who I interview, they all have cell phones. They actually put a lot of stuff up on WhatsApp and FaceTime, and some of the most effective dissemination strategies about where to get vaccinated and what that means and that it's okay have been done on social media. But great question. Thank you.
So I'm looking for more hands, but while I am, I have a question for any and all of the panelists. Oh, where?
There was a question.
Oh, sorry. I'll come back with my question later.
Okay. So I have a question for Maggie. I was wondering, you mentioned that most of the students in your survey at the high school hadn't felt like singled out and had a pretty strong sense of belonging. Just in your overall sense, I know you don't have like the statistical data for this, but do you feel like that's representative overall of transnational students in high schools in Oregon?
I'm not sure just based on our data set if that is something that I can fully answer because, as I said, our data set is kind of this anomaly coming out of an international baccalaureate high school in a very multicultural area in a suburb of Portland. And so what we've really found looking at this data is students on a kind of a surface read are overwhelmingly positive when it comes to their school. And that's why we've kind of jumped into this very kind of more micro level discursive analysis because we want to look at, okay, they seem very positive, but then when you get into the critique, there's a lot more hedging that we see coming from these students. So how are they positioning themselves within the high school? And what we found is that they tend to own the very positive things, but the critiques are there. They're just very subtle. Now, we can't really apply that to Oregon transnational students as a whole, but we can look at that as more of a model of what can other schools do to improve the experiences for these students, and how can we continue to make efforts to ensure that their transnational identities are not only seen but valued. Does that kind of make sense and answer your question?
Yeah, thank you.
Oh, sorry. Yeah, I'm just curious about, for any of you, about the prospects of any legislation going through the state legislature and not merely being introduced, but being passed, and especially, I understand we're heading into the short session in 2022, so not a lot is going to move. Does anybody know, just, are there big organizing efforts? And I guess I also mean, are there legislators who who may carry the legislation and fight for it?
I mentioned in that last slide, or 1 second to last, about those policy examples, because I think it's important. I said to look at them, right, as to how they came to be, who was sponsoring. I can say, Pecun was mentioned here, right, and so Teresa Alonso Leon, for example, very active legislator, but we have more legislators that that are carrying on those efforts. So I think it is what I see, and that's why I think it's important to sort of systematize how, like, overall people, for example, came to be, right? That passed this cycle and being implemented this year, that come from coalitions, but also that the connection of those coalitions to legislators and sponsors that can move those, right, and move from all through those steps, right? When you see the history of the measures, you see all that is embedded in that, right? All the hearings that need to happen. I've served for a number of years. My cycle is almost done with the Commission on Hispanic Affairs. But for example, so we know, right? So the organizations that can provide testimony, that can submit written testimony or provide oral testimony, but sort of I think more of that work in the knowing, you know, the mapping of the different organizations. I have to say, you know, I've worked with the Latinx community here in Oregon for almost 2 decades now, and more often than not now, I see every time I sit with organizations from across the state, are not only Latinx serving, but Latinx led. And so those leaders are very much engaged, not just in the, you know, it's double the work. It is engaged in working with community, but also engaging with major foundations, engaging with policymakers to make those changes. So I think there are, even though this next session is relatively short, I think is the organizing and the getting our ducks in a row now, so that short session, you know, things can happen, right? It's very short and a lot of competing demands, but I think some things can happen. So I'm hopeful that in that way.
Does anyone else want to jump up?
I think that's a great answer.
Actually, I'm sorry to say this, but for the video, we're trying to live stream it. If you could walk up to the mic.
Yeah, I think, you know, if you think about driver's licenses, which are gonna, you know, they're finally gonna kick in. The first time that was a state referendum, I mean, it just lost really big. And it took a long time to build. So even something like farm worker overtime, you know, there's a champion, there's someone who's, you know, there's a lot of organizing. And, you know, I think the people working on it have like the inside plan, and then there's like the plan B about how to pressure people. But it takes time. But I think one of the amazing things is just looking at how many people are talking to one another. Even the research project I was in that involved community-based organizations, you know, they always went to, Pecun was not one of them. And, you know, people always went to Pecun, or they always maybe the Oregon Law Center. But now all these organizations are networked and they're talking to each other and they're organizing on Zoom. You know, so I don't know, it's hard to find something good about the pandemic. But that connectivity, and I think the energy and like the passion for what people saw, yeah.
I just like to, one thing real quick is, I mean, two, I think the Trump administration really galvanized so many groups and so many people in terms of thinking about the politics of all of this. And it's just worth also noting that these are enormously powerful interests. When you're talking about farm worker overtime, the agriculture industry in Oregon, or you're talking about just enforcement, as Lola mentioned, these are the types of political struggles that take several legislative sessions or take even sometimes a decade or whatever it is. But as Dan points out in his chapter, and I would recommend that as well, the politics of immigration in Oregon, it's amazing to have gone from the defeat of driver's licenses, what, in 2014 or whatever the year was, to the types of things the Oregon legislature has done on behalf of migrants. It really is pretty extraordinary, although, again, we still have a ways to go.
Anyone else, or can I go on to the next question?
My question is for Maggie specifically. So you mentioned that you did your study at an majority urban school. If you would have done your study in a more rural school, what do you think would be the differences? I know that you probably don't have that data, but just in your opinion, in what ways do you think that would differ with other data? And what are the advantages and disadvantages of urban versus rural schools?
Oh, this is a very large and very loaded question. So, first off, in full transparency, we never intended the study to happen at the school it did. That was just kind of by happen circumstance. So I think if we had had our druthers and had been able to get kind of the cross-section of students that was more representative of Oregon schools as a whole, we would have done that. I mean, if you think about one of the charts that I showed in terms of student demographics, I think the #1 language in our student population that we're working with is Arabic. As opposed to the Oregon Department of Education says that most students who identify as immigrant, I think it's 40-some% are Latinx. So I think we're talking about, at this point, apples and oranges. But in terms of your question of rural schools versus urban schools, I'm not totally sure I have an answer to that. If there is very much a distinct difference between rural and urban education, specifically in the communities that surround those institutions. Is one better than the other? I'm not the person to answer that. I don't think I have the clout to actually make that statement definitively. So that is kind of a non-answer to your question. Did that answer all 3 parts? Do you feel fully satisfied? Okay. I'm from a very rural school, so those have a special place in my heart, but also that has really no citation in my research.
Can I add one? Yeah, please go ahead. I was going to say, focus quite a bit on my work in Latinx communities. Two data points that I want to share. About 24% of K through 12 students identify as Latinx, but there are over 400 schools across the state in rural communities as well that have 25% or more of their student population identify as Latinx. And there are over 100 schools, again, across the state, not just in the valley, not just in the metro area, over 100 schools that are 50% or more Latinx. And so, so next time you go past Hood River, then there's Boardman, then there's Hermiston, then there's Nisa, right? About close to 70% Latinx now, the town, Nisa.
And that's a town of what, 2,000-ish?
Exactly. And so it is, certainly there are other groups and other communities. I just wanted to throw that to say, right, that there are, I think it's important to, challenge sort of or to put at the diversity, even in our state, with all our history and all our constraints of those communities are distributed across the state, not just in urban or suburban areas.
Here's our next question.
Danielle, it's actually for you, so if you want to stay up there, it's fine. I noticed on one of your slides, which were very informative, by the way, in policy successes, you talked about driver's license for all, and you said that was in 2019, it's effective in 2021. I can say as someone who's not a U.S. citizen, who tried to get a driver's license here without a social security, it is hard. Yeah, and I just wanted to know if you could talk a little bit more of A, if you know how that change came about, and B, how are they publicizing this? Because honestly, I did not know about this. Yeah.
No, that's a good point. Are we recording?
Yeah.
So I think you bring up an important point. So the law became effective January 1 of this year, but just as it is, the law being in the books doesn't guarantee that the organizations that are responsible for making it happen will move in that direction. I think there's a similar experience with Coverall Kids, for example, right? So the Coverall Kids passed, all children, regardless of documentation status, have access to the Oregon Health Plan, but there was not necessarily with it, they didn't, the communication wasn't funded. And so cover all kids is one of the I think one of the important measures, just as driver's license, right? But that they're necessarily communicated. So it has to be, I think, with community organizations to mobilize to pass, right? I know there's a lot of demands on our time to try to get that passed, right? That in and of itself is a very important milestone, but there's work still to be done to make sure that community knows how, that is communicated in the appropriate languages, and so that benefit that is in the books actualizes, and so people have the ability to go to the DMV, get their driver's license. I would say, for example, with the pandemic, I've heard reports of, with the vaccination campaign of asking for IDs, asking for proof of insurance, when there is no such requirement, right? And yet, so the implementation of it, it's certainly there's room for improvement. But importantly, I think to remember that it is enacted. So it is not just. It is the responsibility of the organization, in the case of the driver's license DMV, right, to implement, but it's also, I think, from community to support, sort of push for say, okay, so let's figure this out, how to, and get it done, because it has been, over a decade's worth of work to get that passed. So definitely there's more work on that end that needs to be done to make sure that community and individuals that could directly benefit from that know how to get that benefit actualized.
Can I ask a specific question on that?
Yeah.
So does that provision, especially for students, individuals that might be undocumented, is there any provision in it to protect them from, say, any sort of immigration enforcement?
For the driver's licenses,
Yes.
Yeah. So there is that. The caveat is there is a qualifier to it, right? In the driver's license, part of the process would be to reveal that status. So there is certainly that risk. So all the more important to work from community. From organizations that are trusted by the communities to support that process. In a way, DACA, right, is a comparison, right, that you are providing all this information to the federal government. Your ad, everything, right? But so is that sort of what is the benefit risk? But I think the more that process is accompanied by trusted organizations, the better that we can get to that actually happening. Because it's part perception, but like I said in my talk, it's also because we've seen policy being enacted that also erodes even more the little bit of trust that we can gain through those policy changes.
And there's like one other layer to this. Now it's just another layer to this is that basically if you're driving without a license and you're risking, like you are at rest all the time. That's a huge issue for undocumented workers, And then the other thing, which might be a problem in the future, is that yes, this was passed and it's great, but there's also the real ID. And those who are undocumented won't be able to access real IDs. So that will create like a way for enforcement to immediately know, folks don't have real IDs. They could assume that there's a reason behind it, et cetera, et cetera. So, the legislation is not perfect, and it still creates this kind of like tier and this kind of difference between those who actually have social security numbers and those who don't. So that's something to keep in mind as well.
And we are exactly at 8:30, so thank you to a great panel. Please join me in expressing our appreciation. The last thing I'll mention quickly on this is that Bob and the rest of the authors in this, for this report are planning to have a variety of ways they're going to disseminate their findings. And so stay tuned for other ways to listen more from these panelists and also from other authors who are in this report. So thank you again for joining us tonight.